Yeah, welcome to part 2 of our lesson today of the respiratory disorders. Now, previously we discussed about chronic bronchitis, but this part 2 of our lesson we're going to discuss about the emphysema, which is one of the types of the COPDs, the chronic obstructive pulmonary diseases that we have. The most common of them, this one is, and my name is Brian. Already you can find my videos into the channel. If you feel like you want also to improve on maybe some of the suggestions, you can do that in the comment section so that I can also improve on more notes for you. So here we start. As you may observe that all these conditions have an obstructive state, and there's always an obstruction somewhere, and the gas exchange gets impaired in a way. Now, emphysema is, as defined, you will find it defined as an impaired gas exchange due to the destruction of the walls and of a distension of the alveoli. So the lungs loses its elasticity due to the change in the parenchymal cell. The type of this type of obstruction involves the elasticity, which is actually lost due to the change in the parenchymal cell, and you will find out about the function of the parenchymal cells and the way that this condition occurs is because of deficiency in the alpha-1 antitrypsin. So the trypsin is actually because of the inflammation part, whereby the proteases are being involved in this process. So when the elasticity is lost, the alveoli is not able to, the lung, is not able to have a recoil, or the reflex. You will find out the name. I didn't type it here. The most common, the reflex that causes the lungs from overly expanding will be the hairy brewer reflex, which actually helps in preventing an over distension of the lungs. And now you understand what emphysema is, and we have the types. We have 3 types. I didn't include the third one here. So the first one is the centrilobular, or the centriacina, where the damage is actually centrally, so the central part of the lobule is affected. We have the panacina, is where the destruction is whole lobule, and finally you have the paraseptal, but it's actually the region of the septal area that is destroyed. So there are the types of emphysemas that you have, and also what are the causes of emphysema. The most common one is number 1, as I put it here, is the cigarette smoking. You might have seen that cigarette smoking is the most common one, and the first one actually has a way that everybody has been exposed to this, and I think most of the things that are in this cigarette actually are the nicotine, and nicotine actually makes inflammation process to take place as fast, speeds up fast inflammation process. And then we have pollution, where we have as you may have seen but in terms of pollution, there are many oxygen radicals in spaces on atmosphere that can cause an inflammation into the airway. And also we have a deficiency of the alpha antitrypsin, the one we just mentioned earlier. So the antitrypsin helps with protecting the lung parenchymal cell Yes, and you may find out that there are generations that have an issue with the deficiency of the alpha uh, antitrypsin. So you will find out that it is the most common in their generation. What is the pathophysiology of the emphysema? Now, you may have seen that the parenchyma cells are destroyed. Okay, there is no elasticity, and, also a extension of the alveoli, which largely will lead to a collapse. And due to this, there will be no oxygen to some alveoli that will lead to a low partial oxygen rate, and partial carbon dioxide therefore will actually will increase. And when you know that the differences in this can change the blood pH because of the presence of increased carbon dioxide levels in blood, increases in and thus forms a respiratory acidosis. And finally, they will be having a dead space because of the exchange, and because the surface that attaches to the pulmonary arteries and veins has been pulled up, so there is a dead space, and the pocket spaces has increased, so there will be a vacuum mismatch whereby there will be no exchange of gases, thus increases the level of carbon dioxide in blood. So the person will have an increased oxygen input to try and clear out the acidic state of the pH of the blood, and try and clear out the carbon dioxide tension in the blood. So the patient will be using the accessory muscles to try and beat up for and compensate for an increase in trying to put the balance so that we can bring blood pH to a normal level. What are the clinical manifestations or features of emphysema? A patient will be presented with cough, sputum production, and dyspnea. A patient will be having headache, warm hands, pounding pulse, and flappy tremors. The patient will have neck vein that is distended, by having wheezing. As you may have seen, wheezing is the most common in the patient who are having a chronic obstructive infection disease, and you will find the same common repetitive information in most of the clinical features. The patient will also feel drowsy and also confused. Sorry about that. Then the patient will feel stressed while doing an exercise. So the patient also has prominent eye chest move in one rhythm. Okay. How do we diagnose emphysema? So naturally, the patient will need to do a chest X-ray to show a long hard box stage and intercostal spaces. This actually will show in the X-ray, whereby you will notice that in an area that has space, shows that the air has gone through, and in um, the actually hyperinflated alveoli will largely show in the X-ray. So how you wanna know? It's actually through an X-ray. Sorry about that. And you can do a lung function test, whereby you do an expiration and reduced maximum volume of ventilation. You to check the lung function test. You can use a spirometry if you want. It's the same as chronic bronchitis. So the diagnosis can actually be identified by the doctors or the clinical practitioners. HCPs can assist with the interpretation of the results. Let's move to management. How do you manage emphysema? Just as you've seen, the first condition in bronchitis, we also mentioned the bronchodilators. And we also have the antibiotics, which can be taken prophylactically to protect, because there's reinfection, to also assist with fighting the bacteria that likely can cause the exacerbation of the condition. Also, we have high hygiene, where we say that washing of hands can improve with keeping the bacteria off. So prevention is better than cure. And we also have oxygen therapy. In oxygen therapy, we give a low oxygen, at least 2 liters in slow beats. Okay, so you have to be monitoring as you give. Okay, you monitor the vitals as you give the low oxygen, so that you don't so that you give the body to have a negative feedback, so that you can have hypoxemia coming in, so that the body can adjust to the situation, so that there will be an increased perfusion. So we have the patient will be reducing weight, so we'll be telling the patient to do some exercises with assisted perfusion, light exercises, and that do not cause the condition worsen up under perfusion. So we can have breathing exercises, slow passive breathing, or the affirmative breathing. The patient can be given corticosteroids, and you can give the patient prednisone, and maybe give prednisone, which can be activated to prednisolone, and then assist the patient in terms of help the patient with an inflammatory reset, improve the patient healing process. Okay. What are the complications that are coming from a person who smokes? A person who has developed emphysema, a person will have polycythemia. Okay, the patient will have the polycythemia, a condition that is well known with emphysema. So maybe polycythemia, it's actually a condition. Polycythemia, sorry, the pronunciation as I mentioned. So about the spelling, polycythemia is an increase in the red blood cell concentration in the blood. So in COPD, the body attempts to improve oxygen carrying capacity by producing increasing amounts of red blood cells. So complication arises like this. Then you can have pneumothorax, respiratory distress in a patient with emphysema. So largely that is it. That will be your next. Thank you for listening. I hope you subscribe, and hope you say if the notes can help you, or maybe you feel there's a new sensation, you can put across the comment section to help with more suggestions. Thank you for having me. My name is Brian. Hope you have a nice time. Study well and pass your exams. Good day.